Humanity First Uganda, under its program Gift of Sight, reached out to the vulnerable needy people of Palisa and the neighboring districts and the eastern parts of Uganda, about 325 kilometers from Kampala, the capital of Uganda, with their second annual Gift of Sight free eye care camp. This exercise was aimed at examining, screening, and treating where necessary the vulnerable victims suffering from different eye infections. The free Gift of Sight camp lasted for 3 days, serving more than 800 patients with different eye infections from Palisa and 6 neighboring districts. Out of the 800 patients that were screened, 210 patients were identified with cataract and hence scheduled for surgery. Besides the targeted victims of cataract, this free Gift of Sight camp also catered for patients suffering from other eye infections such as trachoma, allergies, bacterial infections, and refractive error by offering immediate medical help and advice on how their infections could be handled. In an overt interview with the director Gift of Sight, Humanity First Uganda, Mr. Abdul Chwanka.
We've been here from Wednesday screening people with eye illnesses, visual problems and kind of disorders, with our main concentration on cataracts patients. We started with about the turn-up was a bit huge, unlike other camps that we've been holding, that on the very first day we managed to register a total number of 418. Yet our target was 300 patients. As we speak today morning, on the last day of our camp, we've registered about 790 patients. And all of these, we are screening them for those having the different illnesses, those having allergies, those having infections. We are administering medications for them, giving them medication at a free cost, and then they are able to have a better life afterwards. And then for those who are having the cataracts complications, we are screening them and then giving them appointments for the surgeries. I would like to thank the very first group of our volunteers, the doctors we use. They've been hospitable that they as well volunteered to be part of this drive to give back to the community. And the second group I would like to thank are our donors out there. From whichever part of the world you are, you're doing a great service.
In a keen interview with some of the volunteers of Humanity First, this is how they expressed their sincere appreciation to Humanity First for offering them an opportunity to serve mankind.
The event has helped the community of Palisa as a whole, and even Kumi, Ngora, Kibuku, Budaka, we've got people all from there. It has really helped us so much because very many people have been suffering from eye problem, that is mostly cataracts, and they have not been able to access the service because they didn't have money. But this program has really helped. We really thank Humanity First for considering our community.
The people of Palisa and the neighboring districts were greatly humbled by the humanitarian services offered by Humanity First Uganda in improving the sight and livelihood of the vulnerable. Speaking to some of the administrators of Palisa General Hospital, this is how they expressed their heartfelt gratitude to the funders and volunteers of Humanity First Uganda for extending such a helping hand to the needy people of Palisa.
As a district, we need to put more resources in areas like the sight. Because when you check your body, you rather become lame, but you must have the sight. You rather become deaf, but you must be able to see. Because the sight will give you the direction of what you aim at. So I want to appreciate the work that has been done by Humanity First, because it has first of all opened our eyes to see where resources must be allocated.
In an exclusive interview with some of the beneficiaries of this noble service to mankind, they said,
We are really free, we are really very happy because it's a free eye care camp. For the first time, people have it. They are really very grateful. And we hope that, like they have seen this overwhelming number, I hope they will organize and come another day.
Monica Said reporting for MTA International, Africa, Uganda.